Well, hello everyone. My name is Vicki. I see we've just hit 11 o'clock. It's time for our webinar to start. I wanted to introduce myself. We're waiting for maybe a few more people to join us. Just wanted to introduce myself. My name is Vicki, like I said. I work with King County Library System. I am a librarian at the Newcastle Library branch. And I had the good fortune to connect with Megan from Washington Poison Center earlier this year. She was going to offer an in-person lecture training at my branch in Newcastle, but unfortunately, since our libraries are currently closed, we needed to cancel that program. And when I let her know we needed to cancel, she let me know that their organization does have webinars that they could present online. So I took her up on the offer. And so grateful that Megan and Alex from Washington Poison Center can present for us today. Just a quick little blurb about the library. I know our libraries are closed right now. We miss our branches and our interaction with our patrons there, but just wanted to let you know that our staff is working remotely at home, and we are adding robust information and programs into our online library. So at kcls.org, you can find a bunch of authoritative information about COVID-19 that we've curated for you. We have got a lot of online programs that we're adding every day, things that you can access from home, just like this for all ages. For kids, we're doing story times, art programs, we've got craft programs all online. So just search kcls.org on our calendar and online programs, and maybe you can find some other great things to participate in. We have got academic resources for kids that are studying from home. We have got entertainment like downloadable books, e-audio. We've got streaming services like movies and music that you can access, current magazines that you can download straight to your computer. So check out kcls.org. We have a robust amount of library materials and resources for you just waiting there. And with no further ado, I'm going to turn it over to who you came here to hear from. Washington Poison Center is going to give us some great tips about staying safe at home. So I'll turn it over to Alex and Megan. Thank you, guys.
Thank you so much for that intro, Vicki. I personally am a huge audiobook nerd, so I'll probably be perusing your guys' catalog a little later today. All right, folks, so we are going to be discussing some basic poison prevention tips that are applicable to all times, but we're going to have this focus that's specific to COVID-19 because we're all home so much more than we normally are. All right, here we go. Okay, so my name is Alex Orofsky, like Vicki said, and my colleague Megan King. We're both pictured here, and we're both public health educators at the Washington Poison Center. And we've been really fortunate that we've had the capability to shift our jobs so that we can do our work remotely. So we've been doing a lot more webinars lately, and we're still getting used to working out some of those kinks, but I think it's going pretty smoothly overall. So some housekeeping, considering that this is a webinar, and especially because for the most part, we're going to have our cameras off in order to free up the bandwidth. We don't see each other. So in order to keep things as smooth as possible, please keep yourself muted. If you don't, well, we have the power to mute you. And we would like folks to ask questions in the chat box. So we're going to be periodically keeping an eye on that. And then every time Megan and I transition sections, we'll make sure we lay eyes on that and address any lingering questions. And this is being recorded right now, so we're going to post this on our Facebook and our website, and in a few other areas as well, so that if folks you think folks you know might be interested in this, or you wanted to follow up with it, you'd be able to do that. We'll also we can disseminate the slides to anyone who's interested as well. All right, so we would like to get a sense, if you guys don't mind, just to see where you're tuning in from. If you could type your city in the chat box, and you can select it so that everyone sees this, or so that just the organizers, which would be Megan, Vicki, and myself, see this, depending on what you'd like. This is for us just to get a sense of how are outreaches going? All right, well, thank you. And I'll leave this here for just a few more seconds, give folks a chance to chat in, get in a couple here. If you guys don't see the chat box, there should be a little symbol up to the right. All right, looks like folks are finding it fine. All right, I'm gonna go ahead and move on, but if you guys haven't typed yours in yet and you're up for it, please do so as I get going. All right, so here's a bit of a roadmap of our day today. Well, not the whole day, the next hour, I should say. We're gonna talk about what the Poison Center even is. We're gonna do a bit of what we call a home walkthrough and identify various potential poisons just in sort of an average home. We'll have a section on cleaners and disinfectants, then we'll shift to medication management, and we'll discuss some intentional use, and then we'll wrap up with what to expect when you call the Poison Center, so folks have an idea of that. So first and foremost, we are part of the Washington Poison Center. We have existed in one form or another in Washington for over 60 years. We used to be, I believe, 4 regional poison centers that in 1993 were consolidated under one banner. And our bread and butter, and if you've heard of us, you've probably heard of this first and foremost, is our poison helpline. So this is this number here, this 800-222-1222. But we also do a lot of other services. So all poison centers keep track of their data, keep track of who calls, or not who calls them, but what their calls are about, I should say. And we all report to the CDC, so the CDC can monitor any potential outbreaks. And then we also do what we're doing right now, a lot of public health education and outreach that way. So once again, here is our phone number. We are literally always open. And this is the National Poison Helpline. So this will route you to whatever local poison center is closest to you, or based on your area code. And we are open and operating at full capacity throughout COVID. So this is a point we're going to reiterate a lot, that we'd like folks to call us whenever they can, as opposed to calling other lines that are very, very at capacity right now, such as 911. And we'll talk about that in a lot more detail throughout. We are confidential, so the same laws that apply to a doctor's office or a hospital that protect your privacy, those HIPAA laws, apply to us. Ooh, sorry if you guys are getting some feedback. There's a rather loud motorcycle out my window. And I want to emphasize too, we are absolutely free. So you never have to worry about billing or making sure you have the right insurance or anything like that. You're never going to get a bill from us. And we also have interpretation services, so we can speak with folks who prefer to use a language other than English. All right, so just looking at our 2019 data, we've been very recently crunching these numbers. For all of Washington State, we had over 125,000 calls, and these covered over 66,000 cases. So what this tells you is that we do a lot of follow-up whenever possible to try to make sure our callers are okay. All right, so we're gonna do a bit of a discussion on household poisons. So we have a very, very broad definition of what a poison is at the Poison Center. So for us, a poison is anything, any product or substance that is potentially harmful if it's used in any of these 3 wrongs: the wrong way, by the wrong person, or in the wrong amount. Now that's a huge definition. So this could include household supplies, this could be plants, cleaners, that's a really big one we're concerned about right now. Bites or stings from various animals or critters, as well as medications and other substances. So there are, to complicate the definition of poison further, there are so many different routes of exposure or routes of administration for how a substance can get in your body and affect your body. So things that go through the mouth can be ingested or inhaled. So ingested means you swallow it, it goes through your GI tract. Inhaling means you breathe it in, and it can affect your lungs. Ocular exposure means it's going through your eyes, and dermal exposure means it's being absorbed through the skin. And part of why this is kind of tricky is there are certain products that are approved for one route and are safe through one route of exposure, but very unsafe for another. So this is just kind of a snapshot of what a typical home might look like, and some various potential poisons that are in these various rooms. So when we're looking at the kitchen, a lot of folks store meds and vitamins in their kitchen. There's a lot of cleaners normally. And not a lot of folks, or I know I'm guilty of not always considering spoiled food as a poison, but food poisoning is definitely a thing. And then when you look over to this family room here, it lists alcohol, batteries. Not a lot of folks think of batteries as potentially poisonous, but they certainly can be. Carbon monoxide, which can come from like a fireplace or a furnace. That's why it's so important to have carbon monoxide detectors, as well as these other things, cigarettes, plants, and that kind of thing. So this next one, we're going to test some webinar engagement here. For the bathroom, what, if folks could reply in the text box, what do you think might be a potential poison in the bathroom? I'll give a few moments for this. And while you guys are filling that out, I'll chat a bit about the bedroom. A lot of folks, again, keep medicines and vitamins in the bedroom. Jewelry cleaner, if you have jewelry cleaner. Same with perfume and cosmetics and various other things. All right, I'm seeing toilet cleaner, bathroom cleaner, nail polish remover. I got 2 nail polish removers there, all very, very, very true. All right, so let's get a drum roll here and we'll do the reveal. You guys were hitting it on the head there. So more medicines, vitamins, more cleaners, soaps, and a variety of different products. Nail care products. So you guys are really good at this. Okay, let's move on here. So this is what we were just going through. These are ways that someone could have an exposure to something toxic or poisonous in the best of times, even with an organized and clean and contained household. Which mine is not always. But why are we concerned with COVID? Well, we're home so much more, or we should be home so much more right now. And that leads to a lot of things. We have new daily routines we have to juggle. And if, say, for example, you take a medication every morning and you're used to taking this medication on your way to work when you pick up your breakfast and coffee, and you pop that pill right after. Well, if you're not going out to get that breakfast and coffee anymore, you might not have that mental cue to remind yourself to take your meds. We probably have a lot more products at home. A lot of folks have been trying to minimize how often they go out, so when they do go out, they stockpile. And this is on a lot of different things. This could be with cleaners, this could be medications, this could be other substances. And we, because there are more products in the home likely, and we are home more, there is increased potential to access these products. And one of the biggest things is this is an extremely stressful time, not just for us, but for the country, for the whole globe right now. And more stress equals less focus, less ability to focus. It makes it harder to read through instructions for a medication. It makes it harder to remember to fully close a cabinet or store something up high out of the reach of kids. So we have to be even more vigilant. And unfortunately, there are so many rumors and misinformation right now. A lot of products claiming to be a preventative measure for COVID. A lot of products claiming to treat COVID. And right now, that is not a case. There is no single product that can cure or treat this unfortunate virus. And we think it's really important to stay on top of these rumors and this misinformation, because there's the potential for these products to cause harm as well, to interact with other medications and that kind of thing. All right, so we at the Poison Center, and actually at all poison centers in the US, we have been noticing an increase in our overall calls. In this, we have to give the caveat for Poison Center data that it could be for a variety of reasons. It could be that folks are more aware of us. It could be that it's harder to access other services right now, and so they now think that to access us. It could be that there are just more overall exposures. But part of what's so tricky with Poison Center data is not every single poison exposure is reported to us. But we do believe that a lot of this is in response to COVID, folks being home a lot more, folks being a lot more concerned, a lot more vigilant. And a lot of what we're seeing the increases of are substances that are common to COVID prevention. And so hand sanitizer, cleaning products, because that is being used so much more, there's more potential for a toxic exposure to any of these.
So we are going to dive into some of the common things that folks might be at risk for during this time. And we're going to start with cleaners and disinfectants. And my slides aren't advancing. Sorry, folks. Here we go. Okay. So cleaning products, they have always been one of the top things that people call us about. But during this outbreak, as Alex was saying, people are using them a lot more because, you know, they are a very important mechanism for preventing the spread of coronavirus. But they can be harmful if they're used incorrectly or in the wrong amount. And we are seeing an increase in calls about people who have used cleaners incorrectly or used the wrong amount or having some sort of reaction or symptoms after using a cleaning product. The reasons why, I mean, there's probably going to be more products at home. Like I know I definitely stocked up on some more wipes and some more ways to disinfect things, and people are using these products more frequently. Like when they go out into public and come back home, they're probably going to be cleaning themselves and any sorts of things that they took out with them. And then, as Alex mentioned, we also are a lot more distracted right now. We might have kids at home that we're taking care of, or we might just have a lot of stress and anxiety from just all of the isolation and all of the things and the news that are inundating us. So it can be very easy to just not be paying as close attention as we might have used to. So thankfully, there are some really easy ways that people can prevent being exposed or having a bad reaction to a cleaner. So first and foremost, it seems obvious, but wearing gloves. Alex mentioned that there are lots of different routes of exposure. This definitely applies to cleaning products. It's not just people ingesting them. We get calls from folks who have used a cleaner that might be kind of caustic. It might be burning their skin or irritating their skin. So wearing gloves is always a good way to prevent that. And then cleaners can also emit fumes or vapors, which can make people feel sick. So it's always a good idea to open windows and open any doors to make sure that there is adequate ventilation when you're cleaning. And then the last point on the slide is to read and follow all directions and safety warnings. So a really important one within this is making sure you know if a product is concentrated and it needs to be diluted, or if it's ready to use. And making sure that you are following the instructions to dilute a product very closely and accurately. Just because something is more concentrated does not make it better or more effective, and it really can just put you at higher risk of hurting yourself or of having a poison exposure. Another important thing with cleaning products is that we do not want to mix different products, because mixing certain products can create different hazardous gases that can cause a lot of respiratory issues. Can cause you to cough, it can cause shortness of breath or even chest pain. It can irritate your throat and your nose and your eyes, and for some folks it can cause nausea. So there can be a lot of bad symptoms that result from mixing products, and there can also be some very serious ones if there has been a lot of gas produced. So this slide has some examples of the different cleaning products that we don't want to mix. So there's bleach, which is really the big culprit with product mixtures. So we don't want to mix bleach with any sort of acids. So that includes vinegar. We don't want to mix bleach with ammonia or rubbing alcohol. And so for a lot of cleaning products, you're not going to be mixing bleach directly with a bottle of vinegar or bleach directly with a bottle of ammonia. It would usually be more like mixing bleach with some sort of like toilet bowl cleaner or detergent or rinse of some sort. So that's why it's really important that you check the product ingredients on those cleaners that you're using to make sure that they don't contain those different substances. And so they can also go by different names, which makes it a little bit more confusing. Like sodium hypochlorite is bleach and ammonium hydroxide is ammonia. So that's how you're usually going to see them on cleaning products. So it's important to check those product ingredients, make sure you aren't mixing things that shouldn't be mixed. It's also, in addition to like actually mixing the products, sometimes these gases can be produced if we are cleaning back to back with substances. So you have a bucket where you've been cleaning with one product, you empty it out and you do another, that can produce a gas, or even just if you're cleaning the same surface twice. So if you are ever unsure about what is safe to use or safe to mix, you can always call us. We are very happy to answer any questions related to cleaners. The next point within cleaning products is that we really do not want folks to clean their food or use cleaning products on food. Really, there is no evidence right now that COVID-19 can be transmitted through food. And so there's really no need or no point to use Lysol or use some sort of other cleaning product to disinfect your food. And if anything, doing so would just increase your risk of then ingesting that cleaning product. So the recommendations, not just from us, but also from the Department of Health, from the CDC, and from other public health organizations, is to just wash your hands after you get back from the grocery store, after you've unloaded all of your food, or after you get back from the restaurant, wherever, and then just to wash your produce regularly with water. There's no need to put any bleach on it or put any other sort of cleaning product on it. In addition to safely using products, it's also really important to safely store your cleaning products. One big thing that we hear about pretty frequently is cleaners that have been put in other containers. So for example, someone might mix up a cleaner and then they have some left over, they don't want to get rid of it, so they put it into a Gatorade bottle. Well, as you can see from this picture, it's not always easy to tell if something is a cleaner or if something is a cleaning, or is, excuse me, something that you are able to drink. So we call these look-alike products. So it's because of this, it's very important to store any cleaners, household chemicals, and any other potentially harmful products in their original containers. And then to label those containers with Mr. Yuck stickers, which you see there on the right. If you're not familiar with him, he's kind of our mascot for the Poison Center. If you don't have any Mr. Yuck stickers, you can also just use other forms of quickly identifiable labeling. So even just putting other stickers you have in the house, or just using a marker to label something. And then also to store products up high and out of reach of young kids. You can also, as always, give us a call. Our Poison Helpline, it's always open, and we are very, very happy to answer any questions about cleaning products. In fact, I think our nurses and pharmacists probably prefer to get those sorts of just informational questions, because they know that that will prevent a poison exposure in the future. So please give us a call if you have any questions, or if you do start feeling sick after using a cleaner, or if you've been exposed in any way. So it looks like we have another question. So what about on packages, pizza boxes, plastic containers, bottles, etc. from the store? Again, there's really no need to disinfect those. When you get home from the store, again, just wash your hands. After you've been touching any of that external packaging, wash your hands. Before you eat something, wash your hands. They're really just, the risk of putting a cleaner on those products is greater probably than the risk of the virus. The virus really, the biggest way for it to be transmitted is people to people. So we all hope that we won't need to use any disinfectants on food. Does vinegar kill COVID-19? I'm not sure about that one. I can look that up. I know I saw something about different disinfectants that were effective with COVID-19. So I can look that up probably when Alex is presenting at the end and can let you know. All right, so we're gonna move on to hand sanitizer. So hand sanitizer, it's great when you don't have access to washing your hands, but really just like any other product, it can come with risks. So hand sanitizer, in order to be effective, it has to have a high alcohol content. So a lot of hand sanitizers, they contain ethyl alcohol, and it's usually over 60% alcohol. So that is a stronger alcohol concentration than wine, than beer, and stronger than most hard liquors as well. So we get concerned with hand sanitizer when little kids get into it, because it is so strong. If they lick their hands or they try drinking it, they're ingesting a very high amount or high concentration of alcohol, and it puts them at risk of alcohol poisoning. So the good thing about hand sanitizer is that it doesn't taste very good. It's pretty bitter. So a kid probably isn't going to drink very much. And so really, if they are to get into some, they might just end up having an upset tummy. But it is best to call us immediately, even if you think it was just a small amount that they got into. And really, don't wait for symptoms to develop. Just call us right away. It's better to be safe. So preventing kiddos from getting into hand sanitizer, you can be sure to supervise them when they're using it. Use just a small amount, we say like about a dime-sized amount, and have them rub their hands together until they're dry. That way they won't be able to lick it off. And then keep those bottles out of sight and out of reach when they're not in use. And again, please call us immediately if a kid gets into hand sanitizer, and don't wait for symptoms. Okay, another question in here. So I have a very small bathroom. If I use toilet bowl cleaner and within minutes spray knobs with rubbing alcohol, can vapor from the tube become toxic? That is a good question, and I think that is something you would need to call our poison helpline about to ask, because I think it would probably depend a lot on what cleaners you're using and your space. So I would recommend just calling the poison helpline, and they can give you a little bit more direction on that. So we're gonna now turn to medications. So a lot of us take medication, and during this pandemic, we can face a lot of challenges in taking those medications safely and taking them effectively. So most of us, I'm sure, have new routines. So we might be working from home, we might have kids home, and we might just not be going about our daily lives like we used to. So that removes any sort of memory cues we might have previously relied on. So for example, I think Alex mentioned this earlier, where you always take your morning pill after you have breakfast and when you're grabbing your coffee to walk out the door. Well, if you're not going out the door anymore and grabbing your coffee, you might not have that cue anymore to take your medication. There are also a lot of stress and distractions. We might be having some issues meeting our basic needs, or if kids are home, or really anything else that can distract us. And we might have a hard time remembering if we've already taken our medications and other things having to do with those meds. And we might also have potentially lost some access to support. So this is especially important for older adults who might have previously relied on a caregiver, so like a family member or a friend, to help them remember to take medications. And with the need to be socially distant, they might not have access to that support anymore, and they have to be a lot more independent. So there are some good medication management strategies that you can use to make sure that you're able to take those medications safely and effectively. The first of which is to use a medication checklist. So that this is an example here, and we have this posted on our website so folks can download it if they'd like. And it's pretty simple. You just write out the medication and then you check it off when you've taken it. But if a paper format like this is not ideal, there are lots of other options. You can use just a calendar, like a paper calendar on your wall. There are cell phone reminder apps. There are lots of different ways that you can track if you have taken a medication or not. And then there are pill organizers. So pill boxes are one example. And then pharmacies a lot of times will also offer bubble packaging, where they will package up your doses by the time of day and the day that you need to take them. Safe medication storage is also a very important way to make sure that you're being safe with medications in the house. So just like with cleaners, we always want to keep medications in containers, preferably their original containers or in a pill box, and then keep them in a designated area instead of just having them loose around the house. And if there are multiple people in the house who are taking medications, you want to keep medications separate if possible, or if the only place for you to store medications is in your medicine cabinet in the bathroom, you can always use labeling. Like on this slide, we have colored bands that are put around different pill bottles. So one person could have all blue bands, the other person could have all yellow bands. They don't need to be fancy official bands like this, even rubber bands do the trick. Using a medication list is also a great way to really be solid on your knowledge of what you're taking and how it needs to be taken, just in case things are confusing or you're distracted. So medication list needs to include all of your prescription medications, as well as any over-the-counter medications that you regularly take, vitamins, supplements, and any other substances you use, especially those that are used regularly. And so for each of them, at a minimum, include their name, dose, purpose, time of day to take it, and any special instructions that go along with them. For example, if you're supposed to take it with food, or if you're supposed to wait 2 hours after you've eaten to take your medication. We have medication lists on our website that you can download for free, and we also have a guide that walks you through how to create a medication list if you don't already have one. Reading medication labels closely is another important strategy to prevent any sort of medication error. So following the instructions, taking the recommended dose at the recommended time, unless your doctor has told you otherwise. And then a big one is checking the ingredients in medications, and specifically over-the-counter medications, to make sure that you aren't double dosing with any other medications. So we hear a lot about folks who have double dosed with acetaminophen, which is Tylenol essentially, and it's also in a lot of cough and cold medications like Dayquil. And so if you don't realize that a medication is in multiple products, it can be pretty easy to double dose on those. And you can always call the Poison Center if you're not sure about ingredients or if you are double dosing. Then, just like with cleaning products, we want to add labeling to those lookalikes. So we have some examples here on this slide. Eye drops, they look like a lot of other things. They look like nasal spray, they look like super glue, they look like e-juice, nail glue. You do not want to put nail glue or super glue in your eyes. So if you have Mystery X stickers, add those to those harmful substances, or if you don't have Mystery X stickers, you can use some sort of other form of labeling like tape or markers, or you could even color the caps. So like if you want to differentiate between eardrops and eye drops, you can color the caps different colors or something like that. If there are any kids around the home, there are some additional recommendations. So kiddos, if you've ever been around them, I'm sure you've noticed that they love to mimic the adults that are in their lives. So that's why it's really important to take any medications out of sight of them, because they might want to just be like their mom or be like their grandma and take medication as well. Then after you've taken medication, be sure to check the carpet and floors for any dropped medication. The image on the slide shows how similar medication can look to candy. So if it's just loose and on the floor, you really can have no idea what it is. And kids really explore the world with their mouths, as we say often. So it's good to make sure that they aren't able to pick up anything. Then store all medications where they cannot be seen or reached by kids. And you've seen this slide a lot already. Please give us a call if you ever have a medication error, or if you have questions about the medications you're taking, dosing, or anything. Okay, any questions about medications? Doesn't look like it. So we'll talk briefly about self-medicating. So this is a really big concern for us at the Poison Center. There are a lot of different rumors circulating about different ways to treat or to prevent COVID. And there are also all of these news stories and articles that are coming out about clinicians and researchers that are studying different substances, or hospitals that are using these different medications to treat patients that have been diagnosed with COVID-19. So the difference with those medications, though, is that when they're used in a research and hospital setting, they're very closely monitored to ensure that they are safe for patients and that they are the best thing for a patient's health. When people obtain non-prescription forms of these medications, or if they have a prescription and they use that prescription inappropriately, there can be some pretty severe health consequences. So really, we want folks to know that there are currently no approved medications, vaccines, supplements, vitamins, or really any other substance to prevent or treat COVID-19. There are lots of products out there that are claiming to do so, or claiming to boost your immunity and help make sure that you don't get COVID-19. But we really want you to be wary of those product claims. Some products, if they're used, they might have harmful or even life-threatening side effects. They can interact with other medications. That's a big one, especially with vitamins and supplements, because many of them do interact with commonly taken prescriptions or over-the-counter medications. So if you are thinking about using a new substance or a new medication, talk to your doctor or pharmacist first, or call us and ask, what are some of these things, health or safety considerations, that are specific to your body, your health, and your current medications. Really make sure that adding that new substance or new medication is safe for you to do. And also, please never ingest any sort of disinfectants like bleach or any non-pharmaceutical substances. There are some that are claiming to prevent or treat COVID-19, but again, they can have very serious health consequences. So please do not ingest them, and call us if you are unsure if something is safe. We are very happy to help answer questions about this. In addition to self-medicating with potentially risky substances, we are also concerned about other forms of intentional use. So intentional substance use and self-harm or suicide. So this issue of intentional use, it's always been a concern for us at the Poison Center. I put some of our 2019 data on the slide. So out of all of our cases that we heard about last year from all of Washington, 17% of them were intentional. 11% of all of the cases were specifically suspected suicide. So this has been a concern and has been a challenge before COVID-19 hit. But during this time of social distancing and isolation and all of this quickly changing and quickly evolving situation, we are experiencing a lot of increased stress and increased isolation from each other. And this in turn can increase our risk or exacerbate any existing anxiety and depression. So folks might then increase their use of substances like alcohol, cannabis, prescription medications, or other drugs, or they might be at increased risk of self-harm or suicide. To prevent or to help with some of this intentional use, there are some good strategies, like take a break from the news. It's constant. We're just receiving a flood of information constantly about what's going on in our nation and in the world. And it can be really helpful to just take a break from that all and not think about it for a while. Another good strategy is to set up regular communication. So schedule phone calls or video chats or messaging times with your friends, with family, and with other supports. There is so much uncertainty during this outbreak, so it can be really helpful to establish even just short periods of certainty by having that scheduled time and knowing that there are people there, that there's support there, despite all of this necessary distance that we have to have from each other. There are also a lot of organizations and groups like churches and senior centers and libraries, obviously, that are setting up ways to support their members. And so it can be really important to reconnect with them and give them a call or go to their website, see how you can still be involved. And finally, there are some good virtual resources out there. I put a few on this slide, which are linked. So once we post the recording and the slides, you'll be able to go to them. And if you or if someone you know needs emotional support or is thinking of suicide, we have the National Suicide Prevention Lifeline number here. If you need immediate help after self-harm, please call 911.
All right, so now we're gonna shift gears and kind of discuss what to expect when folks call the Poison Center. If the control, there we go. So we've reiterated this a lot, but when should you call us? Call us anytime if you have any question or if it's an emergency, but it doesn't have to be an emergency to warrant a call to us. Like Megan said earlier, our call takers love info calls because it potentially prevents a future exposure. And you can call about yourself, you can call about someone else. It doesn't have to be about yourself. And again, we are still open right now throughout the pandemic. And a lot of why we push, even before COVID, we've always pushed to call us first because it helps alleviate burden on emergency rooms and 911. That's part of why we exist, is to alleviate that pressure as well as to save folks money. This is an older estimation, but last year we estimated on average, folks save about $1,500 per potential ER visit that we're able to help offset. And we also want folks to, stay inside as much as possible, and you have to physically go to the emergency room. So if we can help treat you at home, then that's one less potential COVID-19 exposure. So when you call us, you're going to speak to one of our SPIs, or specialists in poison information. Now, this is a group of nurses and pharmacists and poison information providers. They're awesome. They've heard so many situations. They're very, very well qualified for this. I want to say the average experience for our call taker staff is about 13 years. We had recently hired a bunch of newer call takers, so that dropped the average down a little bit. And if there's ever any situation that the SPIs themselves feel that they can't handle, they will, or that they want to get some additional feedback on, they'll reach out to one of the on-call board-certified medical toxicologists. There are 7 of these toxicologists in the state of Washington, all of whom are connected to the Poison Center. So there's always toxicologist availability, so they can contact them anytime. So they're going to ask you a bunch of questions like what was taken, how long ago it happened, how much of the substance was taken, and how's the person feeling. Now, it is okay if you don't know all of this, and you don't have to memorize this script or anything like that. They're going to walk you through it. It's literally their job. Oh, I just saw a chat that said no sound. Can folks hear me now? I can hear, okay. Let's see. All right, sounds good. I guess the issue fixed itself. Gotta love technology. But yes, so they will ask you all these questions and they'll guide you. So if you don't know, that's all right. They'll walk you through that. And they may ask you to, if it was a cleaner, they may ask you to find see if a certain ingredient is listed on the label or that kind of thing. And they're going to tell you what to do. Hopefully, they'll be able to tell you to stay home and certain symptoms to watch out for if there are any actions you need to take. And most of the time, this is the case. Most of the calls from home, we're able to keep those folks at home. Now, if it is a true emergency situation and you cannot treat yourself at home, they will tell you to go to the ER. And they can actually call ahead and let the emergency room know that you are on your way. And this is kind of an interesting fact that, I did not know this before working for the Poison Center, but we actually also receive calls from healthcare facilities themselves as well as emergency rooms. So if they get a more complex toxicology case, something that they don't see very often, they will reach out to us for a consultation. So that should give some extra sense of security to remind folks that when ERs are calling us, it definitely means that the call takers know what they're talking about. And a lot of times we're able to do follow-up. So we want to make sure folks are still going okay, especially for the more complicated cases. And so our call takers will do a lot of follow-up, and that gives the caller a chance to ask more questions. And they are always welcome to call back on their own as well. They don't have to wait for a follow-up call or anything like that. Once again, you're probably very tired of seeing this slide, but here is the number. So, so you all have it. We want this seared into everyone's brain as much as possible. And we wrapped up actually a pretty good time. This is the end of the presentation, but we're scheduled to hang out here until noon so we can take any additional questions that folks have. So thank you all so much for sitting with us today. This has been our first time giving this presentation, and I think it's kind of a fun one. So are there any additional questions? All right, well, at this point, I think I can go ahead and, oh, thank you very much. I can go ahead and stop recording.